We welcome you back to the program. Of course, our program each Friday brought to us by Hoag Hospital with that new facility in nearby Irvine. Our guest today is Dr. James Caillouette, and he is the Surgeon-in-Chief with the Hoag Orthopedic Institute. Welcome to the program, Doctor.
Thank you very much.
Good to have you with us today. Let's talk about this, the Hoag Orthopedic Institute. Talk a little bit about what it is.
The Hoag Orthopedic Institute is an orthopedic specialty hospital within the new Hoag Hospital Irvine. It is comprised of 2 floors. We have 72 patient beds. We have 9 operating rooms, all focused on orthopedics. And so it's really poised to be the leading orthopedic center for the Western United States.
We know, of course, of Hoag Hospital in Newport Beach has been there for years and years and years. What's different between the Orthopedic Institute and the hospital, both the Irvine Hospital and the one there in Newport?
Well, what we've done is we've partnered with Hoag Hospital to create an institute that focused completely on orthopedics, adult reconstruction like hip and knee replacement, spine surgery, all of the inpatient types of procedures that are done for orthopedics will be done at the Hoag Orthopedic Institute. And after January 1st, all the elective orthopedic surgery that used to be done at Hoag Hospital Newport Beach will now be done in Irvine.
So you're actually going to be a hospital within a hospital, it sounds like.
That's exactly right.
So you have your own staff, your own nurses, your own, as you said, your own beds, your own operating rooms, the whole deal.
That's right, and by doing that, you create a level of expertise and I think comfort for the patients knowing that these nurses are only focused on your orthopedic care. They don't have to take care of the patient who has a appendectomy or a gallbladder next door to you. They are only doing orthopedics, and by doing that, they become more and more proficient every day.
You know, we hear so much about you doctors all becoming specialists. Now our nurses are becoming equally specialized in their training and in their service as well.
That's right.
A little bit about yourself, your practice, some of your specialties, some of the things you do in the orthopedic field.
What I have been focused on in my career is adult reconstruction. So I take care of patients 30 and older who have problems primarily with their hips and knees. And so I do over 500 joint replacements every year, hip and knee replacements, as well as a couple hundred knee arthroscopies every year for patients with torn menisci and things like that.
Obviously, over the years, that technology has changed so much, and I guess the orthoscopic surgery becoming much more in use, and the materials and substances used have gotten better as well.
That's right. Orthopedics has been very inventive over the last 20 to 25 years. There have been dramatic changes during my career for, say, joint replacement patients. When I started out, patients would be in the hospital for 7 to 10 days following a hip or knee replacement. Now, a patient with a hip replacement spends one night. They're up 6 hours after surgery, and they start to walk, and they're going up and down stairs by the end of the day, and they go home the next day.
Wow, wow. And I understand that the surgery, although it's become better, it's also become less invasive. You're able to do more with smaller incisions and less trauma to the body, so to speak.
That's right. I think that we've become increasingly focused on creating a less invasive procedure for the patients. We look at all the modalities that we can use, both pharmacologic and surgical, to try to reduce the trauma of the episode and to increase the rate of recovery.
More and more adults are spending more and more time doing sports they like or physical fitness. As you know, we have 2 fitness centers right here, one right down the hall from us here in this building. So seniors are much more active than maybe they were 20, 30 years ago. We're also living longer, and partly that's because people are more active. The other side of that is we see joints wearing out, knees and other things do wear out, so that's where you folks come in.
Yeah, our job as orthopedic surgeons is to get you back to life, and we really believe that motion is the key to life, and so if we can provide pain-free motion for patients, either through physical therapy or, if needed, through surgical intervention, then our goal is to get you back to dancing at age 99 if that's what you want to do.
Right. And we have folks in this community, as you probably know, that do that.
That's right.
And other things as well.
I take care of some of those. And one of the common questions that they have for me is, am I too old to have this done? And my answer is absolutely not. If you're physically fit and you're in good health and your primary doctor thinks that you are a good candidate from a physical standpoint, then our job is to take care of you.
Sure, and obviously the anesthesiologists have gotten so much better these days about getting a person just to that point where they don't feel anything and they're just barely asleep, as opposed to the old days where people were just zonked out completely.
Well, that's right. Over the last decade, we've spent a tremendous amount of time and energy focused on our pain management. All of our surgeries now are done under regional anesthesia as opposed to strict general anesthesia. Patients are put into sort of a twilight sleep, a very light sleep, and then the spinal anesthetic does the work of maintaining pain relief. One of the beauties of that is they wake up quickly, but they wake up without any pain. Mm-hmm. And then they don't get the side effects of nausea and disorientation that they used to get. And
it used to be that you had to give an anti-nausea medication after the fact, and for some patients to keep them from being sick.
That's right.
Sicker. And also reducing the pain obviously gets them up walking faster. Like you said, they're going up and down stairs before they go home. So.
That's right. Our goal is to avoid any nausea after surgery and to keep the pain to a minimal level so that they can be active.
Right. Other than yourself, what other surgeons are there and what other specialties would we find there in Irvine?
We really have the whole gamut of specialties within orthopedics, everything from hand surgery, foot and ankle surgery, spine surgery, trauma for broken hips and bones, and adult reconstruction. The Hoag Orthopedic Institute, I think it's important to recognize that it's not just the inpatient facility in Irvine, but there are also 2 outpatient surgery centers that are part of the Hoag Orthopedic Institute. So we will do probably over 12,000 outpatient procedures in the coming year and over 4,000 inpatient procedures.
Those outpatient services would be ones where the person would go home that day then?
Oh, absolutely. Yeah, those are things like knee arthroscopy, shoulder arthroscopy, ankle surgery, all the things where a patient will come in, have their surgery, spend an hour in the recovery room and go home.
That's medicine in the years that we are enjoying today. Certainly some wonderful things happening over there at Hoag, and not that we want to encourage people to wear their parts out and need you, but it's good to know you folks are there to provide those services. And I guess you would also deal with things like car accidents and some of those things which would require your services as well.
That's right. Hoag Hospital Irvine has an emergency room, and so if a patient were involved in any sort of a trauma, car accident, falling down, breaking something, and ended up in the Hoag Hospital emergency room, they would then, if need be seen by an orthopedic surgeon and brought to Hoag Orthopedic Institute for definitive care.
Mm-hmm. So they'd be right there, that hospital within a hospital,
That's
available
right.
to serve them. You know, we hear so much about that, falls, especially amongst our older population. One of the main reasons, I guess, folks end up in the ER, we think of heart attack and stroke, but falls a big factor as well.
Well, actually, 20% of the visits to the emergency room are related to the musculoskeletal system. People don't realize that orthopedics encompasses such a large part of primary care, and so we see a tremendous number of people that come into the emergency room, that's for sure.
Great. We thank you for joining us. Continue good success with your work there in Irvine. Thank you.
It's my pleasure.
Good to have you in the program today. Again, that's the Hoag Orthopedic Institute, and that's that hospital within a hospital there in nearby Hoag Hospital in nearby Irvine, California. We'll be coming right back with more right after this brief timeout. Stay with us.
Orange County has a brand new hospital, one with nearly 60 years of experience. Hoag Hospital Irvine offers a wide range of inpatient and outpatient services, including 24/7 emergency care. Centrally located at Sand Canyon and Alton Parkway, just off the 405. Hoag Hospital Irvine, caring for the community.